Hi, today I'll be talking about a very important clinical condition in our practice, that is chronic urticaria and its management. Specifically, the management of chronic idiopathic urticaria, which is likely to affect up to 20% of all patients worldwide throughout their life. We know that urticaria is associated with itchy and painful wheals and flare, even angioedema, which can be really upsetting for our patients. The factors triggering the urticaria are very many, but it cannot be identified in most of the patients. So it remains idiopathic in up to 50 to 80% of all cases, as we know. Through this understanding, the best option, of course, is to avoid the triggering factors, but if in case they are not identifiable, which is so in so many patients, the only treatment of choice that targets the pathophysiology is the use of antihistamines. While all international guidelines, they recommend that second generation antihistamines be used as first line treatment for urticaria, it is really difficult to select the ideal one because of the commonly prescribed ones. They either lack efficacy or they have adverse effects, or then when we need to updose them or increase the dose, then they cause adverse effects. So today I'll be talking about a new drug called bilastine, which is a new second generation antihistamine, which has nearly ideal antihistamine characteristics, which has recently been launched in India. Bilastine has been approved in more than 100 countries worldwide, and it has decentralized approval for 28 European countries. It is backed by really very solid patient data of more than 5,000 patients that has been published in various journals and has been prescribed to more than 22 million patients worldwide since it has been introduced in the market. Bilastine is considered the first choice antihistamine amongst the Asia Pacific country physicians, and ARIA recommends bilastine as the highest scoring antihistamine amongst all the other second generation antihistamines, as it is the only one to achieve the perfect score of 10 in its antihistamine scorecard. In India, it has recently been approved for the symptomatic treatment of allergic rhinitis and chronic urticaria in patients who are older than 12 years of age. The APAC review on the selection of optimal second generation antihistamines for urticaria in Asia has also given its support to bilastine's safety. Looking at bilastine's robust clinical assays and studies in healthy volunteers to the actual accumulated clinical experience as well, bilastine seems to have a profile of adverse events which is very similar to placebo and does not appear to significantly influence cardiac conduction, alertness or driving ability, even in doses of up to 40 milligrams. At therapeutic doses, bilastine does not have significant anticholinergic effects, nor does it affect psychomotor performance. It is a good substrate for P-glycoprotein, which prevents its access to the central nervous system and crossing the blood-brain barrier. As it shows almost zero H1 receptor brain occupancy compared to others, the incidence of sedation with bilastine is almost similar to placebo, even in doses 4 times the approved standard dose. And studies have shown that it has no effect on driving ability and flying conditions for pilots, and hence no cognitive impairment at all is seen compared to other antihistamines. In fact, during the on-road driving test studies, bilastine did not show any significant difference versus placebo. Even when tested in simulated conditions of high-speed driving like Formula 1 cars or operating heavy machinery or flying a plane as a pilot, bilastine did not induce significant sedative effects. An active control arm study was done in which hydroxyzine was compared with standard dose bilastine, which is 20 milligrams, and higher dose bilastine also, 40 and 80 milligrams respectively. It found no significant effect on various objective measures of psychomotor and driving performance with bilastine at all doses in comparison to hydroxyzine. So as a clinician looking at the above qualities, I would really look forward to use bilastine as it checks most of the boxes for the qualities needed to be an ideal non-sedating antihistamine. Bilastine has been acknowledged for use by guidelines such as ARIA and as the only one to achieve a perfect 10 in their antihistamine scorecard. And it has also been scrutinized to become the first choice antihistamine amongst Asia Pacific physicians.